Okay, so we'll quickly try to look at what is known as the initial or routine procedures, okay, that you might actually want to employ in radiography. That's if I want to do some one or two imagings, what are the rules that I should follow? Now, this applies to whatever type of imaging you want to do. These are kind of like general rules that should apply to anything, as long as it is imaging and as long as you are after trying to get what clear images. So for the initial and routine procedures in radiography include the following. First, you have to ensure that the patient you are checking their information is the request, and the patient that is before you in that radiation lab is what? The same patient. So you don't want to come and carry procedure that was meant for a different patient and give it to another different patient that is not in need of it. Do you understand? So you want to confirm all those, the patient's name, just confirm their hospital information, including all those date of birth, hospital number, just to ensure that everything is as requested. So I think that's what this implies. So I also want to access if the patient is contraindicated for any other thing. Okay, the radiation safety, this is where you're now trying to say that, okay, yes, I want to actually get this imaging, but it's also in the favor of the patient, and I have to make sure that everything I'm doing, the patient is not too exposed to the radiations and the rest of it. You are using the shield, you are doing a lot of things just to minimize also the time that the patient is exposed to the radiation. The positioning, you just have to make sure that what the patient is positioned, best position, that will help you get the best image for this. Then you use all those position aids like all those pawns and the rest of it. The image acquisition, you have to just select the appropriate exposure parameters for the patient to use. The collimate, okay, we're trying to actually just take it that the patient to actually expose just the region that is of interest to you. They also ensure correct centering of the X-ray beam. Also acquire the imaging and check for diagnostic quality. Then after the procedure, you are not just leaving the patient, but you are actually helping the patient off the radiation bed, and also making sure that the patient gets to where they are actually being cared for again. Then you have to document all the things that happened within the procedure and everything that we have. Okay, so this is what we have for at least the procedures that you should actually follow. Procedures that you should follow, okay, as the business of getting good imaging actually implies, right? For whatever type of imaging you are having, these are the basic procedures that you should follow for it.